Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about dopamine detox or dopamine withdrawal, part number 2. If you haven't watched part number 1, you want to go back and watch that, where I explain where dopamine is produced in the brain as well as in the periphery, and some of the behaviors that will impact dopamine levels. So let's get right into the low levels and high levels of dopamine and the symptoms. Let's get right into it. Low dopamine, feeling of worthlessness, hopelessness, feeling of self-destructiveness, meaning you want to kind of do things that will be destructive in your life. Inability to handle stress, anger and aggression with small amounts of stress, easily triggered. Fatigue, even after long hours of sleep. Need to isolate. You just don't want to deal with people, right? Which is lack of concern for family or loved ones. Like you can say someone is passed away. It might be a loved one or a friend, and you're apathetic. ADD, attention deficit disorder. Okay. Procrastination, this is big. Poor follow through. Start something, never finish. There's motivational issues. Need stimulants or recreational drugs to get, that high of dopamine. You also have low libido, and you're quick-tempered, angered very easily. Okay? All these symptoms can lead to depression, movement disorders, things like Parkinson or similar types where you get slowness, anxiety, learning disability, especially with also addiction. So you want to be careful when you have low dopamine that you don't fall into something that stimulates dopamine centers and you get addicted to it, especially those drugs, right? So that's low dopamine. And let's talk about high dopamine. When you have high dopamine, okay, in extreme cases, you'll see things, hear things, and feel things that are not present. You can have sexual aggression, inappropriate behavior, leading to things like promiscuous behaviors, excessively social, you want to go out all the time, anxiety, hyperactivity, anger, right? Easily angry all the time, which can lead to mental illnesses, schizophrenia, Tourette syndrome, or hyperkinetic movements that you twitch and do things that are kind of abnormal or out of the ordinary. So these things can be a sign of high dopamine, okay? More extreme cases, obviously. So when we look at the continuum of different symptoms for patients who have low and high dopamine, we can see that in the very low states, you can have things like Parkinson's disease, right? Or Parkinson's disorder. Then obesity, because you're always trying to fuel yourself with carbohydrates and junk food. Makes you feel better temporarily. There's things like depression, ADD, attention deficit disorder, and attention hyperactivity disorders also. Right in the middle is your happy place. Happy and you're balanced. That's where you want to be, okay? When you go and you have excessive dopamine, you're going to be more social, okay? More promiscuous. You're going to have Tourette syndrome. You can have anorexia because of body distortion and perception, right? You're seeing things that are not really there. You can become paranoid and schizophrenic. So if you look at this continuum, low to high, okay? Now, obviously, most people are not going to have extreme symptoms of low dopamine or high dopamine, but when you start to see some of these symptomatology, you may start to relate to it. Yeah, I feel kind of low mood. My self-worth. I question, why I'm on this earth and start to feel like my worth is not there. So you have to look at these symptoms, and if you have 1 or 2 or 3 or more of these, then you have to say, maybe I have high dopamine, maybe I have low dopamine. And then on part 3, we're going to explain some of the nutritional strategies, the strategies to maybe detox from high levels of dopamine. Basically, you have to remove those stimulants that create dopamine spikes in our system. So you can create issues with mood and behavior and movement disorders and all those things related to dopamine. So stay tuned for part 3, where I explain some of the strategies and clinical and nutritional protocols to manage both low and high dopamine. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.